Hello everyone, I am currently a student at Vol State in the MLT program, and I was tasked to complete a case study based on an actual case I had encountered during my time participating in my clinical rotations. My name is Tevi Fish, and today I will be presenting a case study about specimen mislabeling and how a single pre-analytical error in the laboratory can lead to significant clinical, emotional, and legal consequences. This case occurred during my clinical rotations and demonstrates how important proper specimen identification is for patient safety. As an MLT student, I know the importance of proper specimen labeling. Mislabeling specimens can have serious consequences for patient care. This case study demonstrates those risks by using real clinical scenarios with patient names and ages changed to ensure HIPAA compliance. The purpose of this case study is to highlight the importance of proper specimen labeling in the clinical laboratory. Mislabeling is considered a pre-analytical error, meaning it occurs before laboratory testing occurs. Even though the testing itself may be accurate, a labeling error can cause results to be assigned to the wrong patient, which can significantly affect diagnosis, treatment decisions, and patient safety. Specimen mislabeling is when a specimen is labeled with incorrect patient identifiers. These crucial identifiers include the patient's name, date of birth, and medical record number. In addition to the requirements for what should be on the specimen label, it is also important to know how to properly place the label onto the sample specimen. The image on the screen shows how a specimen should and should not be labeled. Starting with the center tube, this is considered the best dressed tube. The label is placed directly under the cap with the patient's name positioned at the top and the barcode oriented straight so it can be scanned easily by the laboratory analyzers. The label is applied smoothly without wrinkles and leaves a visible window to see the blood sample inside the tube. This placement ensures that the specimen can be accurately identified and still allows laboratory staff to visually assess the sample for issues such as hemolysis, clots, or improper fill levels. Now looking at the tubes surrounding it, each one demonstrates a labeling error that could interfere with specimen identification or testing. The tube labeled wrinkled shows a label that has been applied unevenly with folds and wrinkles. Wrinkled labels can cause problems when scanning barcodes and may obscure important patient information. Next is the flying ace scarf. In this example, the label is partially loose and hanging off the tube instead of being securely attached. A loose label can easily fall off or become damaged during transport through the laboratory system. The topsy-turvy label demonstrates a label applied upside down or in the wrong orientation. When labels are placed this way, it makes barcode scanning difficult and slows down laboratory processing in some laboratories. Next, the twisted shirt tube has a label that is wrapped around the tube at an angle or twisted. This misalignment can distort the barcode and make it unreadable for automated analyzers. The tube labeled clenched belt shows a label wrapped too tightly around the middle of the tube. This can cover the viewing window, preventing laboratory professionals from observing the specimen itself. The sample labeled wraparound wraps completely around the tube and overlaps itself. This can obscure the barcode or patient identifiers and again prevent proper scanning. Finally, the turtleneck tube has a label placed too high, covering the top portion of the tube near the cap. Labels placed this high can interfere with automated equipment and prevent proper identification during processing. Overall, it is important to understand how to properly label specimens in order to help the laboratory workflow. Now back to the case study. This case matters because laboratory results inform 70% of medical decisions. Pre-analytical errors are the most common lab errors. Mislabeling can lead to unnecessary testing, procedures, delayed or incorrect treatment for the patient. The Joint Commission and ACL laboratories require two unique patient identifiers. These identifiers typically include the patient's name, date of birth, and medical record number. Because the laboratory relies entirely on proper identification, even one mislabeled specimen can cause serious problems for patient care. Specimens must be labeled in the patient's presence and never with room numbers. Despite these safeguards, the pre-analytical phase remains the most error-prone. High-risk testing areas include pregnancy and toxicology screening. Incorrect results in these areas can lead to legal and social implications, as it is mandatory to report these results. In the case study that we will be covering today, there are two patients, an 89-year-old woman on opioid pain medication and a 25-year-old woman who is 9 months pregnant. Both arrived on a very busy Monday morning during a high-volume shift in the ER, creating a risk for misidentification. The elderly patient's Monday results showed a normal urinalysis and a drug screen that was negative for opiates. However, her metabolic panel showed critically low potassium and decreased kidney function, which suggested renal impairment consistent with chronic kidney disease. The pregnant patient had very similar urinalysis results and had a normal CBC. However, her urine drug screen was positive for opiates. This was extremely concerning because positive drug screens in pregnancy can trigger mandatory reporting and Child Protective Services becoming involved. The immediate consequences. Because the pregnant patient's drug screen was reported as positive for opiates, hospital policy required notifying DCS, also known as the Department of Children's Services. The patient was informed shortly before giving birth, as documented in the chart. This result triggered an entire chain of events, including the DCS notification. As the laboratory reviewed the results, inconsistencies became apparent. The nearly identical urinalysis findings and unexpected toxicology result raised suspicion. The laboratory began an investigation by reviewing collection times, verifying patient identifiers, contacting nursing staff, and ordering repeat specimens. When repeat testing was performed on Tuesday, the results reversed. The elderly patient tested positive for opiates, while the pregnant patient tested negative for them. This confirmed that the original drug screen results had been associated with the wrong patient. Because DCS had already been notified, the healthcare team had to speak with the patient and explain the situation. The documentation shows that the patient was informed of the positive drug screen just minutes before delivery, which created significant stress during an already vulnerable moment. The impact of mislabeling. This case demonstrates how specimen mislabeling can impact much more than just the laboratory results. It can cause emotional distress for patients, legal involvement, incorrect treatment decisions, and damage to patient trust in the healthcare system. Specimen mislabeling also creates financial consequences for healthcare institutions. CAP estimates about a $712 cost per mislabeled specimen due to recollection, additional testing, and prolonged hospital stays. Hospitals can lose roughly about $280,000 per million specimens. In high-volume hospitals, this can amount to hundreds of thousands of dollars. The root causes for the specimen being mislabeled were high patient volume, time pressure, and human error caused by the high level of traffic in the ER. The combination of these factors increased the likelihood of mislabeling during the busy period. Prevention strategies. To prevent these types of errors, laboratories must strictly follow patient identification protocols. This includes using 2 unique patient identifiers, labeling specimens at the bedside, using barcode scanning systems, and maintaining staff competency training, and fostering a culture centered around patient safety. As MLT professionals, our role is not just performing tests. We are responsible for recognizing results that do not match the clinical picture, communicating concerns to the healthcare team, and ensuring patient safety through quality assurance practices. In conclusion, specimen mislabeling is a preventable pre-analytical error that can have serious consequences for both patients and healthcare institutions. This case showed how one mislabeling mistake can lead to legal involvement, emotional distress, and incorrect clinical decisions. My experiences in my clinical rotations reinforced how important it is to always follow proper labeling procedures in the laboratory. The discussion questions. Question 1. How can specimen mislabeling be prevented in high-volume ER settings? Question 2. What should laboratory staff do when results do not match patient history? Question 3. How can MLTs advocate for patient safety? And lastly, the final question. Question 4. How do you think you could lessen the financial impact on hospitals caused by mislabeled specimens? If you have any further questions, please comment down below and I will try to answer your questions as soon as I can. Thank you for watching this video on specimen mislabeling and patient safety. Your attention to these critical practices help ensure accurate patient care.